I chose the disorder xeroderma pigmentosum, and to the right there's a picture of someone affected by this disorder. Genetic principles demonstrated by the disorder or disease. The way I like to understand this is when a person gets a scab on their skin, they have genes that automatically start repairing this scab. Well, right when we step out into the sun, the UV rays from the sun damage our skin cells. There's other toxic chemicals found in cigarette smokes and other things that can also damage our skin. Well, without even knowing it, our repair genes start repairing the damaged cells automatically. Sometimes it could get as bad and cause a sunburn, but most of the time, just from a split second of being in the sun, our repair genes will repair the cells. However, this is the complete opposite with xeroderma pigmentosum. If you have this disorder, you do not have the repair genes to repair any type of damage caused to the skin cells. This is what causes the cancer and all the harmful effects of this disorder. This is an autosomal recessive disorder, which means if two parents have offspring, there's a 25% chance someone will be affected with this disorder. There's a 50% chance that they will be a carrier, and there's a 25% chance that they will not be a carrier or be affected by this. More than half of all the cases in the United States result from mutations in the XPC, ERCC2, or the POLH genes. There are 6 other genes that can cause this mutation. However, these are the most common. List major phenotypic features. Sunburn that does not heal after just a little bit of sun exposure. So like I said before, we can walk outside for hours and we cannot get a sunburn. But if you have this disorder, then you can get a sunburn just from being in the sun for 15 seconds. Blistering can also occur just for 10 seconds in the sun. Spider-like blood vessels under the skin, patches of discolored skin that could get worse, resembling severe aging, crusting of the skin, scaling of the skin, oozing raw skin surface. So, with this disorder, since it doesn't repair any of the skin, it could cause cancer. Almost 75% of the people diagnosed with this disorder will get cancer, and that is most likely the cause of death. History. In physical findings of a case study, there are 26 case reports in the United States right now. A person I chose was Daniel, and he had a case of ectoderma pigmentosum. He was born with this illness. This was confirmed by the genetic examinations of the University of Tübingen. After weeks and weeks of studying his skin, they did a genetic test to determine that the POLH gene was making him get this disorder. The skin of the patient was exposed to light, develops malignant tumors as a result of light rays. So as you can see in the picture, he has tumors all over his face. Continued. As Danielle was between the ages of 6 and 16, a total of 56 partly disfiguring operations were necessary, especially on his face. With all these operations, this is what made him live, and he's still living today at the age of 27. Most people with this only expected to live 16 years. And he is now 27 years old, and he is fortunately living because of all the maintenance they've done. Now, there's no cure for this, but this is a miracle that these tumors have not already killed him. They also perform a lot of skin abrasions where they rub down the skin and then they wrap it up with a bunch of ointment to prevent infections. Background of the disorder's disease etiology, and pathogenesis. This causes the extra chromosome paired with the gene stated, the POLH, the CCC2. This is an autosomal recessive trait. This shows again how there's a 25% chance that you will be affected if both of your parents are carriers, recessive carriers to this. This is caused by mutations in genes that are involved with the repairing damaged DNA. Normal cells are normally able to fix this, but like I said, this causes you to not have those cells to fix any damages done to the skin. And the picture on the right, this shows the exposure to the UV ray lights, the thiamine dimmer, the DNA damage, and then there's no replication to repair this. The diagnosis of this is based on a skin, eye, nervous system test. Like Daniel, he had a special test performed on his blood that showed the DNA repair for the POLH. This can cause mental illness because of the locked up in the house. I mean, it's not that serious, but if you do go outside, you have to be covered in complete clothing. The physical would be, the skin cancer, the blisters, the sunburn, the redness, the scaliness. This can have an emotional impact on you because you do not need to do the normal things that humans do. Oral retinoids have been shown to decrease the incidence of skin cancer, so this is just about management because there is no cure to this disorder. Chemical therapy with 5-fluorotic may be useful. The main treatment for this would be just to stay inside and make sure your skin does not get hit by any UV ray lights for a crucial amount of time. There could be a bunch of surgeries to remove cancer as well, just like Daniel had done 56 surgeries. The inheritance risk, which has been talked about multiple times, but there's a picture right here that shows the unaffected carrier father, unaffected carrier mother, and then the 25% chance of not being affected or a carrier, and the 25% chance of being affected, and then the 50% chance of being unaffected carrier. And this shows the polygenic evolution for this disease, and you can see the yeast right here, and then it goes all the way down to humans right over here. This is also just shows the gray is the percent identical and the yellow is the percent similar.